Okay, so the purpose of this video is to um, talk about telemedicine in gynecology. My name is Dr. David Howard, president, founder, owner of My Virtual Physician, which is a multi-specialty direct-to-consumer telemedicine company. One of the most common questions I get is, how much of gynecology can be dealt with through telemedicine. And what I want to do in this video is really break it down. So let's start with the obvious and then proceed to the less obvious. And what we're going to do is we're going to go disease by disease. We're going to go through the most common reasons why women go to the gynecologist and break each of them down as to how that disease, that condition would be dealt with through a video visit. Let's start with one of the most common reasons of all, irregular periods. Whether it's a woman having regular but heavy periods or irregular periods. Abnormal or irregular periods are one of the most frequent reasons why a woman will go to the gynecologist. However, let's break it down, right? So in someone who is premenopausal and young, the most common reason for irregular periods is a hormonal imbalance. In other words, they're not ovulating regularly. Sometimes the lining of the uterus is dysfunctional. And so one of the most common ways in young women that we fix irregular periods is a trial of hormonal contraception, hormonal management, birth control pills, to be clear. So for a young woman who comes in with irregular periods, once you've taken a good history and make sure that there isn't a specific reason, obviously, if that young woman has previously had an ultrasound showing that she has fibroids or some other specific structural pathology in the uterus, if it's just a woman coming in, young, abnormal periods or irregular periods, take a good history, which you can take through a video connection, a video visit, and you can try birth control pills. And that's one of the most common things that gynecologists do for young women is they put them on a trial of birth control pills. You don't necessarily need a pelvic exam straight out the gun for a young woman who comes in with irregular periods. Now, if birth control pills fail to regulate the periods, then yes, you will need imaging. You may even need to take her to the operating room and look inside the uterus with a camera to see if there's any pathology. And prior to taking anyone to the operating room, you want to do an exam to see how big the uterus is, whether the uterus is pointed up or down, because that will guide you in your surgery. But initially, when that woman first presents with irregular periods, it can be dealt with through a video visit because you really don't need a pelvic exam straight out the gun. You need a good history. And then if it's a young premenopausal woman with abnormal bleeding, you can do a trial of hormonal management with birth control pills. And you can prescribe that electronically. So the entire visit can be done through a virtual visit. And even in step 2, if after a few months, the patient's periods are still irregular, then now you're going to want to get a pelvic ultrasound. You can order that electronically. you can do a video visit, review the fact that the last 3 months have not worked well. Birth control pills are not regulating the periods. And so now you want to get a pelvic ultrasound. The doctor can order that electronically, and then the woman goes to the radiology facility, gets her ultrasound. The ultrasound report is faxed or, to the physician. The physician may actually have electronic access to the images if the radiology facility has a portal, which many radiology facilities do. Many radiology facilities in the community now have portals that they can give referring doctors usernames and passwords to. And so once the pelvic ultrasound is done, the report gets transmitted to the doctor electronically. The doctor can review, and then depending on what the ultrasound shows, then move forward to the next step. So in this short video, we've just seen how something that commonly a lot of people would stereotypically think, oh, I've got to go in. Irregular periods in a young woman, you can now see that actually that can be dealt with through a video visit, at least initially. Now, depending on what you find on ultrasound, there may ultimately be a time where the patient does have to come in. But initially, that initial assessment and management, that can be done entirely through a video visit. And if we take it to the opposite extreme, a woman who is postmenopausal, having postmenopausal bleeding or spotting, the first thing we do as OBGYNs is we get a pelvic ultrasound. And if that lining of the uterus is less than 5 millimeters thick, we actually don't even really need to do a biopsy. The evidence shows that. That is the practice. So even a patient who has postmenopausal spotting, which has to be evaluated, in theory, that patient doesn't immediately, straight out the gun on the first visit, necessarily need a pelvic exam. They can do a video visit, as obviously if the bleeding is heavy, they need to go to the ER. If the bleeding is heavy, then you have to see, why is the bleeding heavy? You have to assess the quantity of the bleeding. But if it's postmenopausal spotting, if it's a one-time thing, a patient had a little bit of spotting, they're postmenopausal, they had a little bit of spotting, they're not currently bleeding now, but they're worried that they had some spotting and they're postmenopausal. That visit can be done, that can be a video visit in which the doctor assesses the patient through a history, takes their history, then the doctor orders a pelvic ultrasound. The woman goes, gets the pelvic ultrasound, report gets electronically transmitted to the doctor's office. The doctor reviews it, schedules a follow-up visit by video. And if the lining of the uterus is less than 5 millimeters thick, then the doctor does not have to do a biopsy. The chances of that patient having endometrial or uterine cancer is so low, the doctor does not need to do a biopsy. Now, if the lining of the uterus is thick, if it's more than 5 millimeters or 5 millimeters or greater, then yes, now that patient does have to come in for a biopsy. But the initial part of the assessment and management was dealt with through a video visit, right? So even in those circumstances, we're talking about abnormal uterine bleeding. We started off talking about a premenopausal patient, then a postmenopausal patient. So yes, depending on what your pelvic ultrasound shows, depending on your history as to how severe the bleeding is, yes, there is a point where ultimately that patient may very well absolutely have to come in either to the ER or the doctor's office for an exam or a procedure such as a biopsy. However, even in those circumstances, if the management is a 3-step process, as you can see from what we just discussed, step 1 and 2 could have been done by a video visit. And then in step 3, that's when they come in. So in this short video, we've talked about abnormal uterine bleeding. That's a condition where a lot of people would stereotypically think, how can you deal with that through a video visit? Well, we've just shown you how, right? Start off with a history with the doctor by video. The doctor orders a pelvic ultrasound electronically if he or she orders an ultrasound. In some cases, if it's a young patient in their 20s with irregular periods, we'll start off with a trial of birth control pills. And if that fixes the irregular periods, that's it. Just keep going, right? So we've seen how, whether it's a premenopausal patient or a postmenopausal patient with irregular uterine bleeding or abnormal uterine bleeding, AUB, we can see now how in the worst case scenario, the initial part of the assessment and management could have been dealt with through a video visit. And in the best case scenario, sometimes the whole management can be done by a video visit. We as gynecologists, the uncomfortable truth is that we probably do too many pelvic exams. And a lot of the times they really aren't necessary. The sensitivity and specificity of a pelvic exam in many cases is actually really low. And the uncomfortable truth is that we gynecologists probably should be doing a lot less pelvic exams. We should be doing it in a very targeted manner when it's really, really necessary. And a lot of the times, uncomfortable truth, it really isn't, right? The combination of a history, imaging, and blood work, that is the trifecta that accounts for the overwhelming majority of the diagnostic process in gynecology. A careful history, imaging like a pelvic ultrasound, and sometimes blood work. The combination of those 3 things, that's what really makes the diagnosis overwhelming majority of times in gynecology. And so hopefully this video has helped to illuminate and open our eyes as to how this thing called abnormal uterine bleeding, how it can be dealt with through a video visit. A lot of people wouldn't think it could. A lot of people still don't realize, but hopefully this video has opened up your eyes. With that being said, I'm Dr. David Howard, founder, owner, president of My Virtual Physician. I hope that you found this informative. Thank you.